So, dear students, today we will be discussing a new chapter called snakebite. Snakebite, if you see the epidemiology of the snakebite, nearly it is happened throughout the world, worldwide. The snake bites has been happening, and more than 5 millions of bites per year by the venomous snake. Maybe if you take the most venomous and non-venomous snake, it may be more. So if you see 5 million bite for the venomous snake, and within this 5 million, 1,25,000 people died due to this snake bite. And the category of people which is dying in this are from 11 to 50 years, and mostly males are get more affected. Maybe they may be taking more risk, or maybe going for work in the fields or something, maybe the reason. And the most common site for the snake, for the most commonly found site are the 40% are from the lower limbs. And if you see the scenario in India, nearly 2.8 million people were bitten by snakes every year, and out of this nearly 50,000 people died from the snake bite every year. So this was the scenario in the India, and this was the scenario in the worldwide. This is 2.8 million in the India and more than 5 millions in the worldwide. If you see the classification of the snakes, snakes can be classified into Colubridae family, that is, and most of the non-venomous snakes like grass snakes or rat snakes comes under this family. And Elpidae family, that is cobra, kite, mamboos, they are all comes under venomous snake. Viperidae family, there are also a venomous snake family which consists of American rattlesnakes or Asian viper snakes or Russell viper, such type of snakes. And Hybridaceae family, that is sea snakes, they are mostly aquatic. Sea snakes are also, they are also poisonous, which is poisonous snakes. And if you see the snake venom, it is a complex mixture of enzymes with low molecular weight, polypeptides or glycopeptides or metal ions. So most of the snake venoms are a complex peptides, a complex enzymes with a low molecular weight. They have polypeptides or glycoproteins or metal ions are there. These are the common some examples of this snake venoms, or the protein or the peptide enzymes which are present mostly in the snake venoms are serine protease is the most common enzymes that causes hemolysis, and other protease enzymes also present, and they are also causing hemolysis. And phospholipase A2 is another enzyme which is present in the snake venom, which causes myotoxic, that is, it causes damage to the muscles, cardiotoxic, neurotoxic, increase the vascular permeability. Such type of effects has been produced by these phospholipase A2 enzymes. And hyaluronidase is another enzyme which causes destruction of the local tissues, and neurotoxins are present, and alpha bungarotoxins of cobra toxins which causes postsynaptic inhibition, and beta bungarotoxin or corotoxins which causes presynaptic inhibition. One causes alpha bungarotoxins causes postsynaptic, and beta bungarotoxins and corotoxins causes presynaptic inhibition. So these are the few enzymes present in the snake venom which causes which causes various different type of actions in the humans. So the poisonous snakes are, we can again divide into neurotoxin, hemotoxin and myotoxins. If you see neurotoxic, cobra, kite and coral are the neurotoxic poison snakes, and hemotoxics are viper, are hemotoxics, and myotoxics are sea snakes are the myotoxic cases. So common venomous snakes, there is Elpidae family, that is common cobra, that is we used to call it as naja or Indian cobra, and common kite we call as Bungarus circulaceae, or Viperidaceae family, saw seed viper or Russell pit viper, such type of things, and other snakes like king cobra, branded kite, and sea snakes. These are the common venomous snakes. These are the common venomous snakes. So, how you can differentiate from the poisonous and non-poisonous snakes? The poisonous snakes, the head scales are smaller, but in non-poisonous snakes, the head scales are larger, and the larger and opening of pit between the eye and the nostril. The pit of the eye of the pit means, that is, the pit means is a heat sensing pit. This is like an heat thermosensor, which sense the prey and other things. Mostly the snake's its visibility is very poor, so mostly it sense the prey and other things by this heat sensing pits. So this will be present in between the eye and the nostril, and third labial touches the eye and the nostril shield of the cobra, and no pit or third labial touches the eye of the nostril shields of the kite. These are the few scientific methods to differentiate poisonous as well as non-poisonous snake. And in poisonous snakes, you can see fangs. They are hollow like hypodermic needles, and but in non-poisonous snakes, they are short and solid. And in poisonous snakes, two long fangs only present, but in non-poisonous snake, several small teeth are present, and tail are compressed, but in non-poisonous, they are having a long tender tail that is not compressed like the poisonous category. So this is how the non-poisonous snakes teeth looks like. They are like a small short teeth. Is a non-poisonous snakes. This is the difference between, you can see the difference between the non-poisonous snakes and the poisonous snakes. Here that is what I told you, the pit, where the heat sensing area, where here it is present in between the after the nostril, but in pit viper, you can see coral snakes, it is present in between the nostril and the eyelid. So this is how we can differentiate. And in non-venomous snake, you can see that the teeth are large number of teeth, short, small hook teeth are present, and here is a heat sensing pit. In this picture, this photo, it is very clear. The heat sensing pit is very clear. This is in between the eyelid and the nostril. And you can see the poisonous snakes, the tails are short, and non-poisonous snakes, the tails are longer one. And these are the few examples of poisonous snakes, that is Indian cobra, neurotoxins, the fatal period is 8 hours, and common kite, the neurotoxins, again there come the fatal period is 18 hours. That means if you are not treating the person for 18 hours, the person will die. That is the case. And Indian cobra and king cobra and coral snakes. This is a saw-scaled viper that is most commonly present in India, and this is a Russell pit viper. This one also is commonly found in India, and you can see the fatal period is 3 days and 5 days. They are produces hemotoxins, and this is how you can identify the viper. It's having a V-shaped neck and the long fangs. The folded fangs are folded and longer. And this is the banded kite. This is a common kite which is commonly present in India. Banded kites are very rare, but common kites are commonly present in India. And this is how we can differentiate the bites of a non-venomous snake as well as a venomous snake. You can see in a venomous snake bite, the two fangs the insertion of two fangs or the injected sites. You can very clearly demarcated injected sites you can find with a venomous snake. But in case of non-venomous snakes, it is not like that. It is a multiple tooth marking can be present in the non-venomous. That is the first diagnosis whether the person has been bitten by a poisonous snake or an non-poisonous snake. So, if the two fang marks are present, then surely we can say the snake has been bitten as a poisonous one. If number of tooths are present, then we can say, okay, this is not a poisonous snake bite, it may be a non-poisonous snake bite into the person. And how we can identify the snakes, identifies the snake and feature poisonous snakes. Usually the poisonous snakes usually looks a dull color, that is brown, black or grayish in color. They have a short body with a abruptly compressed tapering tail. So, a compressed tail with a short body you can see, and a broad belly scale. Their scales over the belly will be broad and large. It will be covering entire width of the belly, and small scales in the triangular heads. The scales in the heads will be smaller, and I told you pit between the eyes and the nostril. The pit means heat sensing pit, as already we discussed in the previous slides. And the presence of hood, that is, you can see in the Indian cobra, you can see a marking of hood marking. You can see some it having a hood marking, some will not having a hood marking. And presence of fangs, that is the two teeth, they are called as fangs of the poisonous snakes. This all comes under, these are the features of a poisonous snake. So, if the poisonous snakes, if you see the fangs are present, if a hood is present, or the dull color with a short compressed tail, okay, you can say that the snake is an poisonous one. So, what are the clinical features of this if a snake bite happens? What are the clinical symptoms can be happen after a snake bite? You can see a flashing of or palpitation can be happen, sweating. So even if they don't know whether it's a bitten by a snake or other thing, also you can see profuse sweating, and also anxiety and fear. That is the prominent features by any snake bite victim. Whether it's a venomous or a non-venomous snake bite, the anxiety and the fear is one of the most common symptoms you can observe in the patients. And specific features of venomous snakes depends upon the type of snakes it bites, or the local systemic features and environments are concluded, or we can conclude it by the type of the snakes. It depends upon the type of snakes, then only we can say the specific features you can see in the snakes. So, grades of innovation. That is non-innovated dry bites. So, how we can differentiate the bites? If a non-innovated dry bite, that is presence of fang marks without local or systemic reaction. You can see a non-innovated dry bite is the person, that means the bite has happened, the snake didn't inject the venom into the patient's body. So, its presence of fang mark will be there without any local or systemic reaction. There will not be any systemic or local reaction will be there. So, mild innovations is bite is a local swelling will be there. A small amount of venom has been injected, then you can say a local swelling. Pain without systemic reaction, a local the area swelling will be there, and without a systemic reaction will be happen. Or a moderate innovation bite, that is extensive local effect, mild local effect with a marked systemic effect. There will be sometimes there may effect with the minimum systemic effect and mild local effect with a marked systemic effect and mild local effect.
A severe innervation means extensive local effect and systemic effect are more commonly seen with an severe innervation bites. So if you see, if you say it's an bites of an Elpidae family, that is a cobra or coral snake bite, generally causes minimal local effect because they won't produce any maximum, they will produce minimum local effect except swelling and local pain and local necrosis happens with the cobra. Except cobra, other Elpidae family won't produce any systemic local effect, but cobra can produce some local effect like swelling, local pain and local necrosis. And descending paralysis, that is a gradual paralysis from the higher limbs to the lower limbs. Initially a muscle inverted by the cranial nerves are common, that is the muscle which is connected with the cranial nerves is the most commonly affected initially in the descending paralysis, that is from the upper limb to the lower limb. That is, you can say ptosis means falling of eyelid, diplopia and ophthalmolgia, double vision and ophthalmolgia can be happen in the initial stage, and followed by a numbness around the lips and mouth. The numbness, there will be swelling in the tongue or numbness happens in the mouth and lips, progressing to pooling of secretion and bulbar paralysis, and followed by respiratory failure. So these are the symptoms can be happen. And paradoxal respiration, intercostal muscle paralysis can be happen. Your skeletal muscles will be get paralyzed because of the less neurotransmitter has been pumped in, so it can cause intercostal muscle paralysis. Some, especially if you have a crite bite, you may get a stomach pain because of the submucosal hemorrhage in the stomach can be happen with the crite. And most commonly, if the crite bite present in the early morning, if a bite happens in the night during the night with a crite, in the early morning, paralysis may be happen. So this may be mistaken as a stroke. So see that the person is getting paralysis or is sleeping outside his house, he may get a bite from the crite in the night, and he may in the morning he may see like a paralysis symptoms can be observed in the patients. Don't check the patient for any fang marks before confirming the stroke. So this is one of the typical symptom of dropping of eyelids. Ptosis happens with bite. You can see the one eyelid has been dropped. And bites of a vipredacean. So severe local effect as early as 15 minutes of the bite. If a bite is a vipredae family, you can say severe local effect is present, and nearly 15 minutes of bites, you can see the effect has been an extensive swelling and spreading quickly and involve the whole limbs. So even it's bitten in the finger, the swelling will be extensive and it will be quickly formed into the whole limbs, and associated with the blister formation, necrosis and regional tender lymphadenopathy can be happen, and hemostatic things can be happen like is persistent oozing and bleeding from the puncture site, from the fang mark site, lateral bleeding from the gums, and also you can see the bleeding from the gums and other areas can be happen. Abdominal tenderness and retroperitoneal bleeding can be happen. Retroperitoneal bleeding can be happen, and passage of reddish dark brown urine or diminishing nil urine output. Sometimes reddish brown urine will be formed, or sometimes diminished or nil anureasis can be happen to the patient. And lateralizing the neurological symptoms like asymmetric people and intracranial bleeding can be happen. Hypotension will be happen resulting the hypovolemia and direct vasodilatation. So low back pain is a very common. So that is the early warning or early renal failure symptoms, indicative. If a person develops a low back pain, that indicates the snake venom has been affecting his kidney. Muscle pain, that is rhabdomyolysis, myolysis can be happen, and parotid swelling and conjunctive edema, subhemorrhages can be happen. Renal failure is very common with the Russell viper, humnose, pit viper. The renal failures are very common, and long term effects are like hypopituitarism, cardiotoxicity can be happen, and saw-scaled pit viper doesn't cause any renal failure generally. So saw-scaled will not cause much renal failure, but Russell viper and humnose pit viper can cause us renal failure in the patients. So these are the symptoms. If you can see, a Russell viper has been bitten. You can see the blister formation and the swelling of the limbs and the entire limbs has been swelled. You can see the bite happen in the finger, and you can see the blister has been formed here. The blister formation here, the bite has been the finger, but you can see later the entire hand will be swelled. That is the local effect produced by the Viperdaceae family. And Hydropidae family bites very rarely happen. Stiffness and ache and tenderness of muscle. Later it will develop into rhabdomyolysis and myoglobinuria, resulting acute renal failure. This is the common symptoms of an Hydropidae family bite. So these are the features of various